So, good evening, everybody. I'm Dr. Charan. We have Dr. Satya with us today. So, today's live is going to be a little different than the usual pattern that we do. Mainly because we want to also enact some scenarios where we'll tell you what are the safe ways to sanitize the things that are coming into your house. That's why we thought we'll do it together rather than on separate screens. So you'll have a better understanding. Sorry. Yeah. So we have Dr. Satya here with us. So do you want to introduce yourself?
Hi, I'm Dr. Satya. I am MS Ophthalmology, and let's start the talk.
Yeah. Today's talk is a little different from our mental health issues that we usually talk about, because I feel as a doctor, I think it's one of the important duties of mine to educate about COVID-19 and also debunk a lot of myths associated with them, because everybody are having a lot of ifs and buts about COVID-19. So I thought Dr. Satya is really informative about this particular topic, so I thought she'll be the right person to talk about it. Yeah. So I already got some questions on my direct messages, also on my mail ID. So I'm going to ask those questions first, so we can take it from there. If anybody has any more questions, you can always post. I'm hoping most of your queries will be solved in our conversation today. So what is COVID-19?
Well, essentially, it's a viral infection. It's a respiratory viral infection, and it spreads through droplets. Droplets are tiny particles of our saliva which come out through our mouth and our nose. And these can come out through either of these orifices during talking, laughing, sneezing, coughing. Sneezing and coughing are the most commonly heard things, but they can also be released while we're breathing. We're breathing, and the virus particles can come out through our nose. So, and it's also secreted through any secretion from the eyes. So, and COVID-19, it mostly affects the lung tissue, but it can also affect any other part of your body as well. But mainly, since it goes through here, it goes directly to your lungs, and that's where the main damage is.
Right. So, like she's mentioning, it is a virus. It's not a bacteria. So, taking antibiotics, a lot of people are panic buying antibiotics. It's not going to help.
But a viral infection can always have a superimposed bacterial infection. So, a treating doctor, if you are symptomatic, and you can consult a doctor, and they'll guide you if you need it or not.
Yeah. So I think one common question that I got today was, can coronavirus spread through food?
Essentially, no. But let's say, so at home, you're cooking food. If it's cooked food, then the risk of getting the infection through cooked food or home cooked food is very less. But if it's a fruit or something that you get from outside that you can directly eat, if it's not cleaned properly, yes. And again, not every fruit or vegetable or a food item which you get from outside will transmit the disease. It's only if an infected person's droplets land on the object and you eat it directly without cleaning. Only then. But no, not otherwise.
Because a lot of people are ordering food, via Zomato, Swiggy, etc.
Right. So we will do a small demonstration about how to order food and eat it. It's simple pleasure of life. You should be able to enjoy it. So we'll show you how to do it in the proper way. But cooked food, if it's hot, and if the food's cooked and the lid is placed, and mostly no. But even, let's say the delivery person accidentally sneezes or coughs on it, and he's an asymptomatic person, then yes. So a simple way would be, any food that you order from outside, if it's possible to heat it, I would suggest you microwave it for a couple of seconds, 15 to 30 seconds, and you can even heat it on a stovetop. But then again, cold food like ice creams and stuff like that, which you can clean or heat, maybe try to avoid for a while.
Yeah, yeah. Also because I know a lot of people who order cold food and they, without cleaning the boxes, they put it in the fridge, and you know the importance of putting in the fridge. Can you tell that?
Right. So the virus can live for a very long time. Some researchers say it can live up to 2 years in a refrigerator, and not a refrigerator, in a freezer. So, you can take more or less the same amount of time, lesser, in a fridge. So, you can clean the container, but you can't clean the content inside. You can't clean ice cream or a juice. So I suggest try to avoid for the time being.
Yeah. Also, I think everybody is stressing about usage of mask, which we'll get into later, but nobody's stressing much about fomites, especially government isn't stressing about fomites.
Yes.
What are fomites?
So fomites are, let's say I'm a COVID positive patient and I don't have a mask, or even a very simple mask which can still transmit the virus through my secretions. So let's say a watch, it's placed on a table and I cough or sneeze on it. So the droplets travel and they fall onto the watch.
And I'm wearing it.
He takes it and puts it on. And he touched it, and with the same hands he touches his eyes, nose or mouth, then the virus can get transmitted. And each material, like for cardboard, for paper, for metal, each substance has a different period for which the virus can stay alive on it, and it can go up to 7 days. Like on metal surfaces and stuff, the virus can stay alive for 7 days. So fomites are a very big thing, and most of the people are not concentrating on it. But imagine a person who's coughing and sneezing, with so much awareness being put out there globally, the infection is still spreading. And it can't all be because people are not being or following hand hygiene or not wearing a mask. It's because of fomites. And this is where for a sick person, using the right kind or the highest filtration powered mask is necessary. Because fomites are, if you ask me, other than standing next to a person who's sick and having them cough on your face, fomites is where the infection is spreading from.
So someone asked about what is the recovery time for coronavirus disease?
Recovery time, let's see. So they usually say you're out of danger after 14 days, but most of the studies now, they're coming out saying that even the home isolation or the hospitalization or the quarantine period is not ending at 14. Yes, you're not going to be in a place where you're going to have complications which are going to lead to a fatal disease, but you can transmit for 3 weeks, 21 days. So you need to isolate yourself for 21 days. It's not 14 anymore.
Right.
So the recovery, major illness like fever, cough, breathlessness and all will come down by day 14. You will feel fine, but there will be a lot of, this is all if you're symptomatic. So it will go on for up to 3 to 4 weeks. Long-term effects, we're still not sure about it. We just know, maybe 6 months. That's the most we know. And they're...
No, also, someone asked about if a person is tested positive and quarantined for, let's just say, 1 month to the maximum, and can he become positive again, or he's going to develop antibodies and immunity to the disease for long-lasting period?
Okay, so it takes about, for proper immunity to develop in a body, it takes about 2 to 3 weeks. And a person who is tested positive might not test positive after a month, but there are very good chances of reinfection, because the immunity it stays from about 2 to 3 weeks. And if your immune system is very active and very healthy, you might go up to, it's stretching to 4 months. Months, not weeks. So an approximate would be this immunity, it's a cellular immunity, would last in your body for an approximate of 3 months. And after 3 months, yes, we are hearing a lot of patients who are coming back saying they're infected again, they have symptoms again, they're tested positive again. So it's reinfection, that is, you have contracted the infection for the second time. It's not a prolonged infection, because it's like any other flu. It's a common cold. It's close to a similar virus. So you will heal, but there are very good chances that you can get reinfected. And also, the second time you get infected, your lungs, if they were very damaged the first time, the second time you get the infection, because your lungs are already compromised or they didn't have time to heal, the chance of your lungs being involved and you having a severe lung disease is increased. But in general, if your lungs were healthy enough and you didn't face much lung disease during the infection, then because, see, antibodies are what develop against the virus, which fade off by 3 months. So there is cell memory. So the development of antibodies in the second infection are much faster. So you will be able to, your body will be able to protect you against the virus in a much better and faster way than the first time.
Yeah, because I thought this question is so relevant, because a lot of people, in a very funny way, they told me that we'd rather get infected now and then develop immunity towards it, against it. So we can be relaxed for the rest of the life. That's not true.
Unfortunately, it's a virus. So bacteria, yes, some bacterial infection, most you won't get them again, but that's not the same with virus.
Yeah, especially this one. Yeah, it doesn't have any long lasting immunity.
Yes.
Someone asked about, okay, I think this is a very common question asked again. Cleaning vegetables and fruits with hot water or salt solution.
No, that's not enough.
Is it helpful?
Hot water and a very mild soap, or liquid detergent, like a dishwashing detergent, or a very mild soap, that would help in cleaning. But just salt and hot water is not effective. Salt will not kill the virus. And even just hot water is not going to kill the virus. The virus is not going to die by the temperature, either cold or hot. So you need to use some kind of a mild soap. It can be a hand soap, it can be mild. Take a bucket or take something, put all your vegetables that you can wash. Put them all in there, and with water or soap or some liquid detergent, dilute it and leave it in there for a minute. Wipe it dry or just air dry it, and then you can pack it up and put it in your fridge.
Yeah, we're going to show some of the common scenarios later. Before that, so Dr. Satya is an ophthalmologist. So a lot of people don't understand that the spread can occur through the secretions, through eye secretions as well. Do you want to talk about it?
Yes. So something relevant to me. Let's see. So the virus can enter into your body by 3 routes: your eyes, your nose, and your mouth. So mostly it's globally told that you just need to cover your nose and your mouth. But the thing is, you can get infected through your eyes. So you have a mask on, and a person who's sick, let's say Dr. Charan is sick and he sneezes or coughs on my face. Yes, I have a very good mask. I have an N95 mask and everything, so I'm shielded. No, that's wrong. Because if he coughs, those droplets, big, small, any size, can land in my eye, and then I can get infected through it, because your eye is directly connected to the blood system, so you can very well get infected. So you see a lot of people with a mask and a face shield. That's helpful, or glasses. In this during the pandemic, if any contact lens users, I would suggest you shift to spectacles, glasses, or have a shield, or you can just use goggles.
Yeah.
Anything to protect the eye. But yes, the severity of infection or the viral load is much less through the eyes than it is through the nose and the mouth.
So someone asked there, how about... Yeah, sorry, go ahead.
Sorry, one more thing.
Yeah.
So if you have red eyes, or if you have like watering and discharge coming from your eyes, it's just like any conjunctivitis or pink eye. this secretion is infective to another person. So you rub your eyes and you're an infected person, you touch anything, that surface and that thing becomes a fomite again, which can transmit the disease.
Right. So someone there was asking, how about soda? Can we use soda to sterilize probably vegetables and fruit?
No, I wouldn't suggest using soda bicarbonate. No, I wouldn't suggest using that. There are so many products out there which we can talk about later. I wouldn't suggest it. I don't use it personally.
Yeah. Okay. They're asking what are the common... Okay, I think this everybody knows, but I think still we should emphasize on what are the common symptoms of COVID-19.
Okay, so WHO, World Health Organization, has released 7 symptoms for COVID-19. So most of you know this, but it doesn't hurt to say it again. So it's fever, cough, shortness of breath. Shortness of breath isn't, some people do the test like, if I can hold my breath for 10 seconds, I don't have it. No, none of those tests are valid or have any meaning to it. So cough, fever. Fever is not just 100, it's above 101, and this is prolonging for 2 to 3 days or more. Shortness of breath, headache, myalgia. Myalgia is generalized body pains. Then there is diarrhea, and then there is loss of smell and loss of taste.
Yeah. Someone asked about does headache. Did you mention headache? Because someone said
I did.
Yeah, headache also, but not every headache can be COVID-19.
No, not every headache.
Yeah.
So you take a painkiller or you sleep or you do something which you normally do when you have a headache, and if it still doesn't subside for over 3 to 4 days and it's accompanied by any other symptom, or if you have come in contact with a COVID positive person and you are experiencing headache after that, yes, it could be a symptom.
Someone asked, does ginger/lemon with hot water helps prevent the infection?
It definitely boosts your immunity, which is very necessary right now or anytime for you to be healthy and for you to have more resistance to fight against infections. But per se, ginger or lemon or hot water is not going to prevent anything. It's just going to boost your immunity, which will help you fight an infection if and when you get it.
Okay, now that you mentioned about immunity, what are the immunity boosting foods?
Immunity boosting foods, well, any balanced, proper diet, fresh fruits, fresh vegetables, milk, yogurt, all sorts of pulses, legumes, just a very well-balanced diet. And vitamin C doesn't necessarily have any substantial effect in treatment of COVID, but there's some non-specific relation for vitamin C to affect the body in a positive way and helps to recover sooner or better, or just helps in boosting your immunity. But no, it has no treatment or no preventive role.
So guys, stop panic buying vitamin C tablets, because people who are actually deficient, who have scurvy and other diseases of vitamin C, they don't get to use the privileges that you're already snatching away from them. Instead eat vitamin C rich foods, which are all your citric fruits. We've been told again a number of times right from our childhood in the school, any citric fruits or any vegetables are high in vitamin C, so you can do that. Someone asked about, we get so many forward messages asking to limit the usage of sanitizers. I think the question is that true?
I would like to add something to what Dr. Charan just said. Vitamin C, if you ask me, unless you are sick, symptomatic and admitted in the hospital, which any hospital that you're being treated, government, private, corporate, anything, they will provide you vitamin C. And other than that, if you're a healthy person and if you're not in the risk group for contracting it, I think you should only take a nutritional supplementation of vitamin C, zinc, D, and maybe after maybe 30-40 years, make taking multivitamins a habit, because it's very good for you. It's proven. But try to supplement it through your diet more than medication, because right now there's a scarcity, because this is a global pandemic, and you can't produce at the same rate as you consume. So be responsible, leave them for the people who really need them, and use your diet to supplement yourself.
Yeah. Also, people who are buying a lot of vitamins and taking with no reason, just know that hypervitaminosis is also a disease, not just hypo or deficiency. It has a lot of symptoms like any other medical disease which requires treatments and antidotes to be given. So keep that in mind before you just take any kinds of medications. Right? Someone asked, the previous question is about a lot of forwards are coming about to regulate the use of sanitizers.
No, you don't need to regulate the amount of sanitizer, because the repercussions of not using it are much, risk and benefit ratio. The benefit of using it is much more than the risk of, I don't necessarily see any harmful effect other than it's going to dry your hands out, which you can always use a lotion or an oil-based cream. But yeah, there are a lot of forwards where, people have sanitizers on their hand and they catch on fire. So just be careful. I don't see any other harm in it.
Yeah, like don't leave your sanitizer in the car also, because it can explode. Remember this, leaving sanitizer, because it has alcohol content in it and stuff like that. Also, instead of sanitizer, if you are in reach of water and a mild detergent, even that works wonderful. So you can probably use water and a mild detergent, mild soap.
Yes.
Yeah.
So the recommendations for using a sanitizer and washing your hands are, if your hands are visibly soiled, like you've come out and you feel like your hands are visibly dirty, then you can use water and soap. But they're not, and you're outside and you don't have access to water, you can use a sanitizer as many times as you want.
So we'll take, sorry for that. So we'll take a couple of questions. One question is, who are at higher risk? Because a lot of young people are very confident that nothing will happen to them. Even if they get the infection, they're mostly going to be asymptomatic. So they're super confident roaming in the malls and God knows where. So do you want to tell?
I'm sorry to break this to you. Every single person, even animals, are at the risk of contracting COVID-19. But it's not untrue that younger people have a milder disease, but there are so many instances that we're seeing globally where a young, healthy person is not able to fight the infection, and they actually do die from the infection. So there are instances where healthy people have not been able to fight it, but yes, more so, healthy people are at an advantage that they will be able to fight the disease better than a group which can't. So the group which can't are, I would say, like it's widely spread. Children under the years of 10 years, elderly people, I would say above the age of 60, or any individual who has any sort of comorbidity, like it could be diabetes, it could be hypertension, cancer, kidney disease, liver disease, any sort of blood cancers, and transplant. Any person who has had a transplant, or any skin condition or any autoimmune condition where the individual has to take immunosuppressive treatment. So, and pregnant women. Pregnant women are not immunocompromised, but they are at a higher risk of, it's two people, so you better take good precautions.
Yeah. Someone asked, any cardiac illness, any lung infection, you are at a very high risk of getting, not getting the infection. Everybody can get the infection, but you are at a higher risk of having symptoms which you might need hospitalization.
And diabetes is also one other major thing that we've been seeing a lot these days.
So someone asked if vegetables soaked in mild soap water for about a minute, doesn't the vegetables absorb the soap, especially the ones with a thin skin?
Thin skin. Let's say the thinnest skin that I know is the tomato, and I wash my tomatoes with a mild soap. I soak it in. I soak it for at least a minute, and no, nothing happens to it. But you need to let it dry very well before you pack it and you put it inside the fridge, or just leave it to whenever you want to cook. But no, the vegetables do not get spoiled, and it does not go into inside. I even wash my grapes the same way. No, they're perfect.
Also, because you cook the food later, right? I mean,
yes.
So it's safe any which ways. So I think we're running out of time. So we're gonna enact 3 common situations that can bring the virus into your house, because we want you to treat your house as the safest place. So 3 situations. The first one is obviously you yourself. If you're going out for work and you're coming home, how do you want to sanitize yourself? Second situation would be if you're bringing groceries, so perishables, non-perishables, into the house. And third is if you're getting food delivered into your house. So first is if you yourself are coming from the hospital or from the place of work, then what do you do?
First, I would say, even before we start showing you any scenarios, I would first say, if you can stay at home, it is best to stay at home. Any high-risk individuals are highly suggested to stay at home, especially if you are individuals in Hyderabad right now or any of the metropolitan places where the infection is rampant. I would suggest stay at home. And if you have people who can bring you groceries, medicines and everything, please do, and please help your neighbors. It is a very difficult time, but it's best to stay at home. If you can work at home, do work at home. And even if you do have to go out to get vegetables, or you need to make a hospital visit, or you need to get groceries, or whatever work it is that you need to do, I would say plan a couple of things to do at once. See, you can plan a day starting at 8 a.m. to 8 p.m. because it is such a prolonged time that you put yourself at a very high risk. So let's say bank, picking up medicines, buying groceries, and filling fuel into your car, and then coming back home. So don't go for groceries once, medicines once. Don't make multiple trips. Use one trip to do most of the things that you need to get done.
Right.
Yes.
Yeah. So before we enact the situations, I think someone asked a very important question. Which mask to be used? Is it N95, surgical, or cloth? Which one is safest?
There's no such thing as safest mask. It depends upon the situation and it depends upon the availability. But any mask, any cover is better than none. So in an ideal situation, a sick person wearing a mask and preventing their secretions or their droplets to infect another person, in an ideal world. But because that's not really happening, because especially in our country, we have so many asymptomatic individuals who are infected and they're not aware that they're infected, so they spread. So the safest bet is wear a mask all the time, everywhere. And yes, there is a cloth, there is a surgical, and there is an N95 mask. Suppose I'm a person and I need to make a hospital visit. I need to get a checkup, or there's some work I have at the hospital. Because hospital is a place where there are a lot of infected people, a positive person would go to a hospital to get checked. And because most of these corporate hospitals or anything, there's no proper ventilation and they're kind of closed. So I would suggest an N95 mask along with a face shield, not just an N95 mask. You need to cover your entire face, and I would suggest gloves as well, and fully covered shoes and fully covered clothes, and as less possible, no accessories, no jewelry, and have your hair tied up. Minimize the area which can get contaminated on yourself to the minimum. So surgical mask, so a cloth mask, yes. If you're at a hospital setting and something like that, like a grocery store or a place where there might be more people and there might be centralized air conditioning and stuff, I would suggest an N95 mask. But if you're going to an open market or if you're going to a petrol bunk and stuff, yes, a surgical and a cloth mask will do. So any mask is better than no mask to protect yourself and others.
Yeah, somebody is asking, can heat kill virus?
No, I'm sorry. Well, it depends upon the amount of heat. Like on a stovetop or on the microwave, like we just said, you can heat some food and eat it safely. Yes, that kind of heat, yes. But sunlight and stuff, no. I'm sorry, it's not going to.
If it did, I think India would have been at like much better place.
Yeah. So no heat, no cold. Temperature has nothing to do with it. Humidity has nothing to do with it. No.
Yeah.
Climate doesn't really affect it.
Yeah. So I think we're quickly gonna enact the three situations. First is if you yourself, for example, she's a doctor, I'm a doctor. If you're coming home from the hospital,
We'll stand up and show you.
So how do you want to do it? How do you sterilize yourself?
Can you give me
Yeah, let's focus towards you.
just a second. So let's say I'm a doctor and I'm coming home from work. So I have the typical things. I have my purse, I have my keys, I have my cell phone, and I have a water bottle. So I come into the house and the first thing is none of these things should be open to a place where they can get contaminated, and if there's a situation where that does. So I first come home, I take my purse, I put it in some corner of the house which I'm not going to be visiting the rest of the day. There are purses, I do usually carry a purse which I can actually wipe down with a disinfectant cloth. But when I'm carrying something like this, I would put it in some corner of the house where I'm not going to be visiting. Then my keys, my phone and everything, I put on one corner, either on the floor or on a surface like this. So I use a Clorox wipes, which is a disinfectant wipe. So it's basically Clorox is a bleach. So I use this. I take a wipe. So all of this, just put all of these down. First go wash your hands for at least 20 seconds with soap and water. And then I take so it doesn't have to be a Clorox wipe, it can be a facial wipe, or it can be just a piece of cloth, a napkin, a cloth, an old rag, anything, and take some sort of disinfectant. It can be any sort of bleach, a diluted amount of bleach, 1:5 ratio, or 1% hypochlorite solution, and basic home cleaning stuff like a Lysol liquid or Dettol. I wouldn't suggest you. So see, this is a hand sanitizer. I wouldn't suggest you to pour it into your hand and then with that liquid wipe it down like this. No, that's not really going to work.
Which a lot of people are doing, by the way.
No, but that's really not going to work. The same sanitizer you can probably take on a piece of cloth, or this can be Lysol, this can be any detergent that I mentioned to you just now. So you take it and you wipe it completely clean. And this surface is infected, so put it away. Then I take my phone. So the same thing. This is how you clean anything that you bring into the house. So every single thing needs to be cleaned. So you think, what's there in a phone? You put it next to your face and you use it. Your fingers are touching your phone, and the same fingers can touch your face. So.
Also the surface.
Yes. So the surface which I placed all of these things in, I'm going to clean it. And you should not discard this in your regular trash can. You should discard it outside or in any trash can which there is a lid to. So that's very important.
Guys, discarding it safely is also very important, because it shouldn't become threat or source of fomite or infection for other people. Yeah, remember that.
So a hand sanitizer, any hand sanitizer which you use to sanitize your hand. There are a lot of regular sanitizers in the market, but I would suggest one which has more than 70% alcohol. That is the one that's going to help. But in a situation you don't have anything better, any sanitizer is, then again, like a mask, better than nothing.
Yeah. So I think that's the first situation.
Yes, that's the first situation.
So second situation is, let's just say the groceries are delivered, right? I'll be the delivery boy.
So first of all, I'm not supposed to take it from the delivery person by hand.
Yes.
It's supposed to be placed outside or inside your house by the delivery boy, and you're not supposed to come in close contact with him. So once the delivery, it's placed in your house. So you pick it up, you put it where you want to. So you place, so take each thing out, like a couple of things. Let me just pick out a few things. So these things are going to remain on the floor. So the same kind of cloth or whatever I just told you about. Clean every surface, every single thing.
These kind of covers can have a lot of creases, so flatten them or straighten them and clean them, even the undersurface, guys. Because I see people just doing it like a half-baked job.
So what happens is, yes, if you put it in the pantry or if you put it away for maybe a week and start using it, yes, maybe the virus is dead. But then again, if you're going to consume it, like today, I got this today, and let's say this is a bag of chips. I'm going to hold it or put it on the sofa, put it on the bed, and I'm going to be eating it while I hold it, and the same hand I can touch my face with. So it's very important to clean absolutely every single thing. And a lot of people would say, I'm going to put it away in a separate room or in the balcony for 2 to 3 days so the virus can die. Yes, but do you really want to risk it? Because the virus, nobody really knows how long. I mean, it's still very new. No one really knows exactly what's happening. So even if it's a week later, I would completely suggest you to clean everything before you put it into your house. Treat your house like a sacred temple. So the same cleaning I would do for these two.
Also, guys, a lot of people are cleaning them and re-cleaning them again and again because they're very anxious. You don't have to do that. If you clean them once thoroughly, that's as good as done, right?
Yes. Cleaning it once is the same as cleaning it 100 times. So there's no, like once it's cleaned and put inside, you don't have to think about cleaning it again. So once you bring things home, immediately clean them and you're safe.
Yeah.
So
also, I think someone was asking about, see, tomatoes and fruits and all you can wash in the detergent. Mm-hmm. But what about things like onions and some things which can't be washed? What do you do?
Well, onions you really can't wash them. So, but the thing is, sometimes it's not very widely used. But sometimes I do it. Like you peel the onion, you put the you can't store the onions after they're cleaned or when they come in contact with water. But while you're peeling and cutting them, you do put them in a bowl of water, right? So that bowl can have a mild detergent if you really want it. Otherwise, I would leave it aside for about 10 days. And personally, I do, the water which I do take to while I'm cutting the onions, I do put a little bit of detergent, yes.
Yeah, or you can just leave it at least minimum of 3 days.
Yeah, minimum of 3 days, but I wouldn't risk for 3 days. I would say a week or above.
Okay.
Or the least a week.
Okay. Now the last situation is obviously the food is being delivered, and now I'm gonna place it on the floor. So what do we do? I mean, I suggest not to order much. I mean, I personally ordered quite a bit recently, but I personally suggest don't order too much.
So the delivery boy has left, so I'm gonna pick it up. So I'm gonna first take them out of here. So I'm not going to put them on the table. I'm going to leave them on the floor. Yes, it's food and stuff, but it's covered. So I'm just going to show you one box. So I take the box, I open it, and someone's going to hold so I'm going to transfer the food into the plate.
Without touching the plate.
Without touching the plate. And then this you can either throw away or you can wash separately if you want to keep and use it for later. And then I wash my hands and then I can just, heat for a couple of seconds. And
yeah.
The thing is, if it's a plastic box like this and you do want to store it this way or you want to eat it this way, the same thing, I will clean it thoroughly, let it dry, and it's good as new.
Yeah. Also, just because the food is hot, it feels warm. A lot of people don't heat it. The idea is not to just eat because it is hot or cold. It's just to, if a food handler or a packer or anybody had coughed or sneezed into the food, and if he's an asymptomatic carrier, then that's a problem. So you should be very, very careful about that. And people who are eating salads and things like that who order, so they have to be careful. It's not a cold salad or something like that. All right. So I think we are pretty much to the end of our conversation today. I hope we were able to demonstrate as clearly as we can. I want everyone to be very, very safe. I know it's a very difficult situation. All this seems like a hassle, but not just COVID. I think doing this kind of sanitation helps preventing a lot of other infections as well. In fact, after COVID pandemic started, we doctors are seeing a lot of reduction in other infections, bacterial and viral, because people are being very careful with their hand hygiene and respiratory etiquette and other sanitation process. So let's try to learn, some good things from this, and let's try to learn some good things from this, and let's try to adapt a healthy lifestyle. Any parting thoughts? Anything else you want to address?
So I have a question. So do you think it's more important to maintain physical health or to maintain mental health?
Yeah, mental health is definitely affected, and we've been talking about it. So
Yes.
Anybody who's going through anxiety or depression, loneliness, etc., have to be aware of and conscious about their symptoms. I don't want to elaborate further because of time constraint. So we can probably do another session, or anyways I keep talking about mental health issues, so you can address in one of the other sessions.
There are a couple of things I would like to say before we end the session. So testing. There are a lot of rapid testing kits available. There probably will be available at any medical store in the coming days. But these are an antibody test. They're not specific. And a person who had a viral infection in the recent past, like dengue or such, these people can be presented as positive because they have antibodies towards virus. It's not specific, it's not sensitive. So if it's negative, it's most probably a negative, but if it's a positive, then you should go for other tests like the standard RT-PCR tests and stuff.
Yeah. Also, I think we'll end the topic by showing the right usage of mask and what are the don'ts of using mask. I see a lot of patients who come to me, they come like this, right? And they say, "Hello doctor."
Oh my god.
That's a big no-no, guys. And one more thing, they fold it and they put in their pocket, right? You can't do that as well. Or what they do is they just leave it hanging to a side, touching their collar, the back, everything. So you can't do any of this. So can you show the right usage of mask?
Yes.
I mean, this is not the ideal mask, but with whatever we have right now.
So this is a standard mask. So before you leave the house, sanitize your hands, and then you're never supposed to touch the mask in any of the blue area. So there are these two elastic flaps. So you take them, open them, and don't do this because you're just rubbing it all over your face. So take them with both hands, put it behind your ear and adjust it. And a good mask is supposed to be tight at the nose, and your mask is never supposed to touch your eyes, because if the mask gets infected and it touches your eyes, you're infecting yourself. And it needs to cover both sides, and it needs to be fit. Not too tight, not too loose. And since the minute you put your mask on to the minute you will take it off, never are you supposed to touch it here or anywhere. When you're taking it off, I would suggest you to take it off in this manner, like this. And if it's a washable thing, there's a whole separate procedure for that. If it's a disposable thing, this is how you're supposed to discard it. And a mask is never supposed to be thrown in the open, not in the dustbins in your house. It should be thrown, like if you come back home, put a separate trash can outside your home which has a lid. And if you want to be too careful, have a plastic cover where you discard all of them, and every 2 or 3 masks, tie it up and throw it away. Never discard it in an open place because it can infect other people.
Yeah. I think one last quick question. Somebody is asking about, because a lot of people are using cloth masks. They're even stitching cloth mask in their house. What is the process of cleaning them and reusing?
First of all, any regular cloth mask is not going to cut it. It should be a 3-layered, and it can be very tight. I see a lot of people with cloth mask which is just like arresting their face. That's not good, because if it's a single layer and resting your face, it's directly in contact with your mouth, so it can easily just go in. So it needs to be 3-layered. And once you come home, wash your hands, take it off directly, and wash it with anything, a soap solution, anything which you use to clean your hands with is enough. Like laundry detergent or any kind of soap, even a hand soap, like a bar soap. Wash it and dry it. Dry it completely and dry it properly. If you dry it in the sun, very well. And if you do have an iron box, I would suggest you iron your cloth mask. So that amount of heat will kill any virus or bacteria that's remaining on your mask.
Yeah. Also, I think one last thing what we forgot to demonstrate was when we come from a place of work or outside, we just told you how to clean your accessories, but you yourself, and also a lot of people touch the doorknobs, and they keep touching the doorknobs because you obviously the main entrance you would open and you have to sterilize that as well. It all sounds like a big deal, but once you get into the routine, it's just it's a semantic memory. It's very normal, like how you drive without much or how you type easily on your phone. It's as simple as that. So do you want to tell last thing, so how do you clean yourself, as in like hair and things like that?
So the hair, I usually, when I go to work, my hair is up, and when I'm seeing patients, I have a head cap. So if I'm just going out for grocery shopping, bank, visiting, the supermarket or something like that, my hair, I would prefer it to be, you can cover your hair with a bandana, with a scarf, with a cap, whatever you want it. The safest is to cover your hair as well, because if you don't come back and wash your hair and you sleep on the pillow and you're sleeping on your back and you turn around, your face is directly touching the contamination. So that's the best. So like I said, like a dupatta and everything, yes, I'm not going to tell you how to wear your clothes, but while I was trying to clean them, you saw how things were falling off. So I would suggest minimal and fully covered clothes. Yes, and any part, like you open the door, you walk inside, wash your hands first, and then close the door, and then handle anything else.
Yeah, I mean.
And shower right away.
Yeah, shower right away. Don't you go sit on the couch and
no.
Some people have something called COVID chair where people who can come from out can sit on it. No, don't do any of that. One last thing, as responsible citizens, not just as doctors. There's a lot of water being wasted, guys, because 20 seconds. Can you tell about that quickly?
Yes. So because we're in one global pandemic doesn't mean we push the earth into another one. So plastic, and because of these masks, disposable mask. A disposable mask which is like this, or a cloth mask which is triple layered, are essentially the same. So if you ask me, being a responsible person, I would suggest you use a cloth mask, a triple layered, well stitched, well covered mask which you can wash and use again, because this is a lot of waste of plastic. And N95 and everything, yes. So when you're washing your hand, I would suggest you wet your hands and take the soap. While you're doing this, please kindly turn the water off, because an infection is fine, but it's not fine. But can you imagine a global pandemic of no water?
No water. You can't even buy water. Right now, some of the privileged people, we might be buying water. You can't even buy water. This we can treat as doctors, but that I think nobody can treat.
And if you're people in Hyderabad, you probably know in the summer months you have to buy water. And I know a lot of people in the rural areas which are not having, they can't buy it, they can't afford it, and there's just no water to buy. So like food deliveries and all, like before, the same plastic bags, you used to reuse them for other things in the house or trash or whatever, and now people are just throwing things away. Kindly don't use that. When you go into a grocery store, take a cloth bag and just wash it with the rest of your stuff. Just because of the pandemic doesn't mean you push the world into no water or plastic filled world.
Yeah. All right, on that note,
one last thing, from a lot of personal stories that I've heard from family and friends and acquaintances, what's happening is, I know it's a very contagious disease. I know you cannot go close to a person who's infected, and the world is becoming a very untouchable place. Like, you walk away from people and everything, but there's no excuse for not being kind to one another. You can be kind to one another. Like, if someone's coming close to you, you can move back, you can walk away, you can do it with a smile, or you can kindness is what's most important during this time. See, an infected person, I'll give you an example. I'm sorry if I'm taking too much time. It's just one example. I heard it from a friend. A father and daughter are living together, like the rest of the family is scattered somewhere else. So the father had comorbidities and he succumbed to COVID-19, and the daughter, she is in her 20s, but she's severely disabled from polio. So she can't cook, or she can't go out and bring food or groceries or anything for herself, and she lives in a small village. So nobody helped her to get food or nothing. Nobody said a good word. It's not you don't have to treat people like they're untouchables. Yes, mostly the infection is spread if people are being irresponsible, not wearing a mask, but there are instances where people can be doing everything right and they can still contract the infection. So be kind. So this girl, she didn't have food. Nobody helped her. So she actually took her life. So that's not where we want to go in the world.
Yeah. Also, I think even old couple, whose kids are living away or something like that, please be kind and probably offer them help. Ask them if they need some groceries, because they can't order on apps. Maybe they can't. They don't know how to do the payment and things like that. So a little bit of kindness goes a long way. It's going to come to you even in a better way. So for that matter, I think all of you, please be kind and empathetic towards others, and let's heal together.
We're all in this together.
Yeah, we're all in this together. Yeah. So I really thank Dr. Satya for giving a lot of insights about the current pandemic. If you think the information is a lot that you can't register, I'm gonna save the video. Please go and watch it again, and also tell other people. And because there are a lot of WhatsApp forwards which is mostly ridiculous, so don't fall for that. Whatever we said are quite researched, and whatever we know, from WHO and CDC and things like that. This is very patent information, not patent, very correct information. So, all right. So all of you stay safe. Good night.